Hey everybody, welcome back. This is Mike. So, a cognitive behavioral therapy therapist treats depression by helping individuals identify and change unhelpful thought patterns and behaviors that contribute to their low mood. CBT is a structured, goal-oriented therapy that focuses on current problems and symptoms, equipping patients and clients with practical coping skills. Here's a breakdown of how a CBT therapist typically approaches depression treatment. 1. Assessment and goal setting. The therapist will conduct a thorough assessment of the individual's depressive symptoms, their history, and how these symptoms impact their daily life. Together, the therapist and client will establish clear, specific, and achievable goals for therapy. 2. Understanding the link between thoughts, feelings, and behaviors. A core principle of CBT is that thoughts, feelings, and behaviors are interconnected. The therapist helps the client understand how negative or distorted thinking can lead to negative emotions and unhelpful behaviors, creating a vicious cycle of depression. 3. Cognitive techniques, modifying the thinking patterns. Identifying automatic thoughts. Clients learn to recognize the immediate, often negative thoughts that pop into their mind in various situations. These might include self-criticism, catastrophic thinking, all-or-nothing thinking, or overgeneralization. Cognitive restructuring or reframing. The therapist guides the client in challenging these automatic negative thoughts. This involves gathering evidence. What evidence supports this thought? What evidence contradicts it? Considering alternative perspectives. Is there another way to look at this situation? Decatastrophizing. What's the worst that could happen, and how likely is that? Replace unhelpful thoughts. Developing more balanced, realistic, and helpful thoughts to replace the negative ones. Thought journaling and thought records. Clients often keep a diary or use worksheets to record their thoughts, feelings, and behaviors in specific situations, helping them track patterns and practice cognitive restructuring outside of sessions. Behavioral techniques, modifying behaviors. Behavioral activation. This is a crucial component for depression. Depressed individuals often withdraw from activities they once enjoyed, leading to further low mood. The therapist helps the client schedule pleasurable activities, encourage engagement in activities that bring a sense of pleasure or accomplishment, even if the motivation isn't initially there. This could be anything from a short walk to a hobby. Graded tasks break down overwhelming tasks into smaller, more manageable steps to reduce feelings of being overwhelmed and increase a sense of mastery. Monitor activity levels. Track activities and their impact on mood to see what helps. Problem-solving skills. Depression can make problem-solving feel impossible. The therapist helps clients develop systematic approaches to identify problems, brainstorm solutions, evaluate pros and cons, and implement chosen solutions. Activity scheduling. Creating a structured schedule to ensure engagement in meaningful and enjoyable activities, helping to combat inertia and build momentum. Role-playing. Practicing difficult social interactions or situations to build confidence and develop more effective responses. Skill development and homework. CBT is highly skill-based. The therapist acts as a coach, teaching clients specific techniques and strategies. Homework assignments are a critical part of CBT. Clients are expected to practice the learned skills between sessions, such as challenging negative thoughts, scheduling activities, or engaging in problem solving. This reinforces learning and helps clients become more of their own therapist. Relapse prevention. As therapy progresses, the therapist helps the client identify potential triggers for depression and developing a plan to manage future challenges. This might involve recognizing early warning signs and implementing learned coping strategies. Overall, the CBT therapist empowers individuals with depression by helping them become aware of their thoughts, feelings, and behaviors, understand how these elements interact to maintain depression, develop practical tools and strategies to challenge unhelpful patterns, engage in more positive and rewarding behaviors, build resilience, and reduce the likelihood of future depressive episodes. CBT is often a time-limited therapy, with the number of sessions varying depending on the individual's needs. They can be typically range from 5 to 20 sessions, and it can be delivered individually, in groups, or through guided self-help programs. So what are your thoughts? What are your thoughts on how CBT can be used to treat depression? Let me know in the comments, and I'll speak to you next time.